Welcome back to Toganta Health. Hemorrhoids are quite prevalent among both men and women, affecting approximately 1 in 20 Americans. The typical age range for developing hemorrhoids is between 45 and 65. Pregnant women are also frequently affected. By the time they reach 50, around half of individuals will have experienced symptoms associated with hemorrhoids, including itching, bleeding, and rectal discomfort. At any given moment, about 10 million Americans, roughly 4% of adults, are already dealing with hemorrhoids. It is estimated that 75% of Americans will have hemorrhoids at some point in their lives. Older adults are also more prone to hemorrhoids because they have weaker supporting rectal muscles. Hemorrhoids are swollen or enlarged veins found around the outside of the anus or within the lower rectum, sometimes referred to as varicose veins. The rectum is the final section of the digestive tract, leading to the anus, where waste is expelled from the body. Everyone naturally has hemorrhoidal tissue in this area, made up of blood vessels, connective tissue, and some muscle. These structures act as cushions and typically do not become swollen or enlarged. However, as we age, this condition becomes more frequent, leading to what we commonly call hemorrhoids or piles. Hemorrhoids are often linked to straining during bowel movements, though other activities that involve strain, such as lifting heavy objects, can also contribute. Pregnancy and excess weight increase pressure in this area, making hemorrhoids more likely. While hemorrhoids can be uncomfortable, especially if they occur frequently, they are usually not serious. Symptoms tend to resolve within a few days, and there are many effective treatments available, even for the more troublesome types of hemorrhoids. Hemorrhoids are either internal or external. Internal hemorrhoids form inside the rectum, which is the section of the large intestine that connects to the anus, and they are usually not visible. These types of hemorrhoids typically do not cause pain, but are often associated with painless bleeding. In some cases, internal hemorrhoids may extend outside the anus, a condition known as prolapse. When this occurs, the hemorrhoids may retreat back into the rectum on their own, or can be gently pushed back into place. But we will talk more about this when we discuss the 4 different groups of hemorrhoids. External hemorrhoids, on the other hand, appear beneath the skin around the outer area of the anus. These are usually the most uncomfortable, often causing itching, pain, or a noticeable lump. If a blood clot forms in an external hemorrhoid, it is referred to as a thrombosed hemorrhoid, which can lead to intense and persistent pain. While clots may dissolve naturally, a doctor can remove the clot, especially if addressed within the first 72 hours for the best results. Noticing blood in the toilet after a bowel movement can be quite concerning, and it is one of the most common signs of hemorrhoids. Other symptoms to watch for include bright red blood on toilet paper or in your stool after using the bathroom, itching around the anus, pain in the anal region, particularly when sitting, discomfort during bowel movements, hard, tender lumps near the anus. If you are experiencing any of these symptoms, try to avoid excessive straining, rubbing, or cleaning around the area, as these actions can aggravate irritation and itching, and may even cause bleeding. Instead, gently pat the area dry rather than wiping. There are 4 groups of hemorrhoids: 1st degree, 2nd degree, 3rd degree, and 4th degree. 1st degree hemorrhoids are the mildest form. These hemorrhoids are located inside the rectum and typically do not protrude outside. While they may cause symptoms like itching or slight bleeding during bowel movements, they usually do not result in significant pain. With lifestyle changes and home treatments, 1st degree hemorrhoids often resolve on their own. 2nd degree hemorrhoids are similar to 1st degree but have a distinguishing feature. They can prolapse or extend outside the anus during bowel movements. Fortunately, they tend to retract inside afterward. Symptoms can include bleeding, discomfort, and the sensation of fullness. Like 1st degree, 2nd degree hemorrhoids can often be managed with conservative treatments. 3rd degree hemorrhoids are more advanced. They protrude outside the anus and do not return inside on their own. However, they can be pushed back inside the rectum manually. This group often comes with increased discomfort, swelling, and pain. Treatment options may include more aggressive home care, medications, or medical procedures if symptoms persist. Finally, 4th degree hemorrhoids represent the most severe form. They are permanently outside the anus and cannot be pushed back inside the rectum. This condition is often accompanied by significant pain, swelling, and complications such as blood clots. Fourth-degree hemorrhoids typically require surgical intervention for effective treatment. There are several factors and habits believed to contribute to the development of hemorrhoids. Chronic constipation or diarrhea, excessive straining during bowel movement, and spending too much time sitting on the toilet. These behaviors can disrupt normal blood flow in the affected area, causing blood to pool in the vessels and resulting in hemorrhoids. Certain factors can increase your likelihood of developing hemorrhoids. A diet low in fiber, being overweight or obese, which places extra pressure on the hemorrhoidal tissue. Aging, as the connective tissue in the rectum and anus tends to weaken over time, potentially leading to bulging hemorrhoids. And pregnancy, especially in the third trimester, where the growing fetus adds pressure to the abdomen, causing the veins in the rectum and anus to enlarge. Fortunately, this issue usually resolves after childbirth and is not harmful to the mother or the baby. To diagnose hemorrhoids, your doctor will ask about your symptoms and review your medical history. They may check for signs such as skin irritation, lumps or swelling, external hemorrhoids, prolapsed internal hemorrhoids, skin tags, leftover skin from absorbed blood clots in thrombosed hemorrhoids, and small tears in the anus, known as anal fissures, which can cause itching and bleeding. Your doctor might also check for blood in your stool, assess the muscle tone of your anus, and conduct a rectal exam to identify internal hemorrhoids. This exam is performed in the office using a gloved, lubricated finger, known as a digital rectal exam, and an onoscope, a lighted tube inserted a few inches into the anus to allow a clear view of any issues inside the rectal lining. If you are over 40, your doctor may suggest further tests to rule out other causes of bleeding. You can usually manage hemorrhoids at home, and symptoms should improve within a week. However, if they persist or if you notice rectal bleeding, it is important to consult your doctor, as recommended by the National Institute of Diabetes and Digestive and Kidney Diseases. Rectal bleeding may indicate other digestive issues or bowel diseases, such as ulcerative colitis, Crohn's disease, or even anal or colorectal cancer. This is especially critical to address if you are over 40, as it is essential to take these symptoms seriously. Preventing constipation is essential when managing hemorrhoids. Making changes to your diet and lifestyle, particularly by increasing your fiber intake, can significantly reduce symptoms. Fiber supplements like Metamucil, psyllium, or stool softener such as Citracel methylcellulose can help keep constipation at bay. However, it is important to avoid laxatives, as they can lead to diarrhea, which may worsen hemorrhoid discomfort. There are several ways to relieve hemorrhoid discomfort at home. Try a sitz bath, a warm shallow bath that targets the affected area. You can purchase a kit for this at most drugstores that fits right over your toilet. Apply an ice pack to reduce swelling. Avoid straining during bowel movements. Properly clean the anal area after each bowel movement and keep it clean. Sit on cushioned surfaces instead of hard ones to minimize swelling and prevent new hemorrhoids from developing. Use over-the-counter pain relievers like ibuprofen, Advil, Motrin, acetaminophen, Tylenol, or aspirin if needed. And consider using over-the-counter creams, ointments, or pads containing hydrocortisone or witch hazel to reduce swelling, pain, and itching. Be cautious with hydrocortisone products, as prolonged use can weaken or thin the skin, so limit their use to a week at most. If home treatments are not effective for persistent hemorrhoids, medical procedures may be necessary. For painful external hemorrhoids, a doctor can excise them during an office visit after numbing the area with a local anesthetic. For internal hemorrhoids, several procedures are available. The most common is rubber band ligation, where a small rubber band is placed around the hemorrhoid's base, cutting off its blood supply. The hemorrhoid typically shrinks and falls off within a week, though multiple visits may be needed for complete treatment. Other options include sclerotherapy, which involves injecting a chemical to create scar tissue and shrink the hemorrhoid, and infrared coagulation, where a beam of light helps form scar tissue that cuts off the blood flow. For larger external hemorrhoids, or cases involving both internal and external hemorrhoids, or a prolapsed internal hemorrhoid, surgery may be required. A hemorrhoidectomy involves removing the hemorrhoid and surrounding tissue via a small incision, usually followed by stitches. This surgery has a high success rate, but can result in postoperative pain. Another option is stapled hemorrhoidopexy, where the hemorrhoidal tissue is repositioned and stapled in place, with the staples eventually falling out over time. This procedure is designed to minimize postoperative discomfort. Keeping your stool soft and maintaining regular bowel movements is key to preventing hemorrhoids. Here are some tips to help you avoid constipation. 1. Increase fiber intake. A high-fiber diet makes stool softer and easier to pass. The USDA's dietary guidelines for Americans recommend men under 50 need at least 34 grams of fiber daily. Women under 50 need at least 25 grams of fiber daily. Men over 50 need 28 grams daily. And women over 50 need 22 grams daily. Be sure to increase fiber gradually to avoid gas and bloating. 2. Incorporate fiber-rich foods. Fruits, such as berries, avocados, and pears with skin. Vegetables, example broccoli, artichokes, and Brussels sprouts. Whole grains, namely brown rice, quinoa, and oatmeal. Legumes, for example lentils, beans, and green peas. Include nuts and seeds, as these make great fiber-filled snacks. 3. Consider fiber supplements if you are not getting enough fiber through food. 4. Limit low-fiber foods. Avoid foods like cheese, fast food, and processed items if chronic constipation is a concern. 5. Stay hydrated. Drink plenty of water and fluids. The Institute of Medicine suggests women should drink 2.7 liters or 91 ounces daily. Men should drink 3.7 liters or 125 ounces daily. This includes water from food, but remember that caffeine and alcohol can dehydrate you, so they should not count toward your fluid intake. 6. Exercise regularly. Aim for 20 to 30 minutes of moderate aerobic exercise each day. Regular physical activity can help keep your bowels moving and may assist with weight loss, which can also reduce the likelihood of developing hemorrhoids. Additional tips to prevent hemorrhoids include: do not strain or hold your breath during bowel movements. Straining increases pressure on veins and can lead to hemorrhoids. Next, respond to the urge. Go to the bathroom as soon as you feel the need. Delaying can make stools harder and more difficult to pass. And finally, avoid prolonged sitting. Sitting for too long, especially on the toilet, puts unnecessary stress on the veins around the anus. If you found this video helpful, we would love for you to subscribe to our channel and give us a thumbs up. Remember to share this video and click the notification bell to stay updated. Until next time, take care.